deal and manage with the inflammation associated with this dysfunction. Okay, so that's the second one. The third one, herpes, inflammation. Don't we have some other things that are associated? Yeah, histamine. So you should not use histamines when you have asthma. Why? Antihistamines will actually cause mucus to become thicker and more viscous. The more viscous, the thicker it is, the more you are to have a deficiency in oxygen being transported to the alveoli. So basically, you can't breathe. So you don't want to use antihistamines. They recommend against it. However, histamine itself, if you block the release of histamine, that's a whole nother story. So antihistamines bind to receptors, but removal of histamine means that you don't have it available to stimulate anything, right? So side effect-wise, probably a little bit better to deal with antihistamine, not to deal with antihistamine blockers, but to deal with what we call mast cell stabilizers. What does that mean? Well, mast cells, like basophils, so we're going to say mast cells, basophils are associated with, we're going to write eosinophils, because eosinophils are what? Eosinophils are associated with allergic reactions and parasites. Well, IgE, which is an immunoglobulin or antibody, IgE is also associated with allergies. So IgE will bind to basophils and mast cells to release histamine. So we're going to talk about that later. But let's say mast cell stabilizers like cromolyn. Cromolyn is the generic name. It is a mast cell stabilizer that reduces or inhibits the release of histamine from mast cells and basophils. That's easy. If I don't have histamine, I'm not going to see herpes or inflammation, right? So it's another anti-inflammatory. What else do we have? The last one is monoclonal antibodies. I believe I only know the brand name. It's called Zolair. Zolair is the brand name. Black box. Remember, this is the only one that has black box warning. All these other, when I looked it up, they don't have black box warning. But this one does, because you can have an allergic reaction to it, anaphylaxis, which can potentially lead to death. So we have Zolair, monoclonal antibodies. How does this work? Well, it blocks the binding of IgE to mast cells and basophils, which means what? Which means that I'm not going to release histamine. So these last two are associated with histamine release. This one blocks it by stabilizing mast cells so they don't respond and they don't release histamine. And this one blocks the binding of IgE, which would trigger the release of histamine. So these last two are dealing with histamine or blocking the release of histamine. Black box warning, again, like I said, Zolair, monoclonal antibodies, you might have an allergic reaction now, maybe your first dose, or you might have an allergic reaction to it within a year, after a year. So you just have to watch and monitor patients if they are on this. This is really expensive right now, so I'm not sure how often it's going to be used, but one thing to watch. This is helpful, and hopefully that helps you a little bit with understanding the dysfunction and how to treat the different dysfunctions.